A lot of people ask, how much pain will I have during the procedure? Well, we have to numb up the scalp. So what we usually do is give patients Valium or some type of anxiolytic to relax them, as well as a Percocet. And then the first thing we'll do is mark the scalp, make sure we know exactly where we're taking the hair from, where we're putting it, and a game plan, how many follicles we'll need in each area and that sort of thing. And then they'll come in and we'll do the actual injections to numb them up. Now, of course, this process does hurt a little bit because they're injections, and that'll take about 8 to 10 minutes. We do a field or regional block back here, and that will get the scalp virtually numb for the entire procedure. After the extraction method, we'll separate the follicles. We'll look at them and inspect them to make sure they're healthy. We'll segregate them into 1, 2, 3s, and 4s, meaning that some follicles have 1 hair, some follicles have 2, some have 3, some have 4. So we'll separate those follicles, and it's important to separate them because it's part of the strategy in how we put them in. Usually the 1 or the single unit follicles will go in the front, followed by some 2s, 3s, and 4s, and this will restore a much more natural looking density pattern to the scalp to avoid the pluggish look, so to speak. After the extraction, we have to numb up the front of the scalp. This takes a few minutes actually, and again we use very small needles and anesthetize the front area or the back here where we're putting the follicles. And that process where the hairs are implanted takes generally between 3 and 5 hours. In the extraction method, again, 3 to 5 hours. Meaning the entire day is going to take basically 8 to 10 hours or more depending on how many follicles we use.